You're listening to IHC's Podcast.
Welcome to the IHC Podcast, where culture meets community. I am your host, Marissa Hemstreet from the Canyoncito Band of Navajos. I'm also the Communications Coordinator for Indian Health Center of Santa Clara Valley, where we provide a number of services ranging from medical, dental, counseling, WIC, and prevention services to over 23,000 members, while specializing in the unique healthcare needs of American Indians and Alaska Natives. And today we're here with...
Hi, my name is Dr. Tamara Strong-Chavez. I am a clinical psychologist at our behavioral health department. A little bit about me. I am Chilkat Tlingit, Alaska Native. I'm a Ganach Tedi clan, that is Raven Frog. And Psy.D, Anshawahi Akla. My name is Anshawahi Akla. A little bit about my work is I'm located at various locations. I am with the Silver Creek, Meridian, Westwood offices. We also have behavioral health at our O'Connor Family Med clinic, and I am just working with the team on developing a pediatric behavioral health at the pediatric clinic.
Awesome. Thank you. How long have you been a counselor or LCSW? What exactly is your title again?
Doctor in psychology, clinical psych. So I've been a psychologist since 2019. I completed the program and I licensed this past year.
Wow, congratulations.
Thank you.
Awesome. How long have you been with IHC?
Since 2021, yeah.
Awesome. Well, I'm glad. Thank you for joining us on today's podcast.
Mm-hmm.
What is it like to work in your profession so far?
It's rewarding. I really enjoy working with others and helping serve our community. It's very humbling to enter a space that you create as a safe space for people to be able to talk about really hard things, especially really hard things with initially a complete stranger. So it is building that trust and the connection and helping others break stigmas over mental health, as well as helping them on their healing journey so that they can live life fully fulfilled. Right.
Mm-hmm. That's awesome. And would you say that that's like both part of like the challenge and the rewarding part of what you do?
Oh, actually, that is not the challenging part. That is just the part of providing counseling. The challenging part really would be more of logistical things, right? So managing the insurance part of things, resources, as well as for some people, it's hard to be able to, transportation-wise, to get to a clinic to be seen. And then also for telehealth, there's some limitations and barriers with being able to access video. Mm-hmm. So there's those type of logistical things. And then there's also helping teach people and understand what psychology is, what mental health is.
Okay.
Mm-hmm.
Wow. I never thought of the like you're saying with the telehealth and having folks have access to cameras and things like that. Some like most folks, especially like after the pandemic, we would assume that like your laptop would come with the camera, but then there's cameras break and things like that.
Yeah, and for many people, they don't have laptops. Mm-hmm. And for some people, just the advances of smartphones is not really aligned with what they grew up with, right? So it's a lot of new things, and there's a lot of other barriers that come up with accessing these things, like poor connections, low Wi-Fi, those type of things. Things that in some cases most people take for granted for.
Well, thank you for sharing that. Well, part of the reason that we have you here, Tamara, is because May is both Mental Health Awareness Month mm-hmm. and Missing and Murdered Indigenous Peoples Awareness Month. Mm-hmm. MMIP, for those of you who don't know, is a movement that demands the end of violence against Native women, girls, Two-Spirit individuals, and a red hand over their face, just like Tamara and I have today, has become a symbol for the movement. It stands for all the missing relatives whose voices are not heard, and it stands for the silence of the media and law enforcement in the midst of this crisis. And it stands for the oppression and subjugation of Native women who are now rising up to say #NoMoreStolenSisters. And so while we get to stand together against violence, it is important for us to also work towards prevention. And that's why we've invited you here today to talk about the importance of mental health awareness, because that does have a role in the MMIP movement. Mm-hmm. So what would you say is mental health?
Yeah, that is a loaded question. I actually asked a few of my grandsons because I was like, whoa, I wonder what other people consider mental health. Mm-hmm. And my children and my grandsons, they all had interesting answers. And the reason why I chose a child to ask, because I thought, how do young kids understand this, right? It is very much in our social culture. Social media explains about the importance of emotional health, feelings, emotions. A lot of these things are now embedded in the children's shows and overall social media. Mm-hmm. So, the real answer to that is going to depend on each person, right? What are we going to take from it? And what that means is mental health is how we see, interact, and be in the world. So when our mental health is affected, that's looking at our emotional, psychological, and social well-being. So when those are affected, it's going to affect our functioning. It's going to affect how we're seeing the world, interacting in the world, and really affect ourselves, our core self, right? That is mental health. Yeah.
Yeah, so often we hear it as like this buzzword and, the phrase that we hear that we should take care of it, but like never specifically like what it means. So thank you for sharing at least your interpretation.
Yeah.
Mine is just being okay. Being content, not being angry or, working, like realizing that feelings are feelings and they are meant to be felt, but not turning my internal things that are going on with me and letting that affect the other people around me.
Yes, that is a part of it. And that also leads to like where I was speaking about, it's going to mean different to everyone, mm-hmm. right? And what one person can tolerate with their social emotional well-being, another person will be like, no, this is not my norm. Mm-hmm. I'm not okay with this, right? I need a little bit of support to help understand how to manage the stress, mm-hmm. or an outlet to talk, someone that you could talk through and process the stress. The part of feeling okay, I'm dealing with this, right? Mm-hmm. That mental health is being okay. You're in balance, right? You're mm-hmm. feeling like when you think of the medicine wheel, you're in balance of it, right? However, it doesn't mean that you couldn't benefit from counseling.
Mm-hmm. Of course, I know. I did a speech last year. Well, not really a speech. I was doing a thing called a Two-Spirit panel at San Jose City College. Mm-hmm. It was a really cool event, and there was a question that was like, what can we do to be better allies and things like that. And I was just telling folks, and I was like, just get counseling. Everybody needs a therapist or mm-hmm. at least somebody that they can confide in and talk to. Hopefully a licensed professional, mm-hmm. and you're not just trauma dumping on someone and they don't have the capacity to deal with that.
With the drama, making those trauma bonds, right?
Yeah, and I was just sharing that, like, it's for the vast majority of folks, if they've dealt with something, everybody has some type of trauma in their life, mm-hmm. and I think it's irresponsible not to seek counseling, not to seek help. Yeah. Not to at least improve your mental health and well-being. Yeah. Because no one, like I was sharing earlier, no one deserves the wrath of your emotional unwellness. Yeah. Because I've been on the other end of that, where folks were going through things, and I was able to understand that it wasn't anything that was going on with me. It's just that they weren't having a great day and maybe not a great year. Right. And I try to not internalize their anger or their episode.
Yeah. That's good. Yeah. That is that is like those moments, right, where you're breaking those mental health stigmas. Because it's taught to us within our communities, within our families, and within our own self over, do I need help? Is this really going to be supportive? I just need to get over it, right? Mm-hmm. Those are some common things that come up. And for some people that are kind of contemplating it and thinking, I feel like I need some support, but I don't know where, I don't know how, and they seek support from friends. And it's one person that can make a difference to say, it looks like you can really benefit from some counseling. And where it's a non-biased person who has the clinical expertise to help, to be able to help you process whatever the stress that you have, as well as maybe learning some coping skills to manage the stress.
Yeah, I like that. So outside of Indian Health Center, I also, this past semester, I was working at San Jose State University as a peer mentor. Ooh. One of our homework things that we work on with our mentees is introducing them to our counseling and adult psychology department, and just saying, like, hey, if school is stressful, if you ever feel that you need, like, to talk to somebody, or if you feel like you're in crisis, you can use this CAPS program, and just showing them that resource. And because I wanted to lead by example, I also set up a CAPS appointment, and I went into it because I have a regular therapist. I went into the CAPS appointment like, I'm just kind of here just to see how this goes. And there was a questionnaire before I was in that appointment, and based on the questionnaire, I cried in the appointment, and I was like, whoa, I did not expect this. I thought I was good. What happened? But again, you never know what extra help that you can use. And so based on that appointment, they were like, yeah, there's this 3-week seminar that we're doing, and if you want to join us, I think you would really benefit from this. And again, learning more coping skills, and just being introduced to community who've maybe been through something similar would be helpful. And I didn't even think, I'm going to benefit out of this, and because again, I have a regular therapist, and so I mean, even if you do have a regular therapist and you are at a university or a school that offers a CAPS program, I mean, check it out. You never know what kinds of things you might learn.
That is excellent. Yes. It's more support, the better, right? Especially when you're a college student, because that is stressful. And you go through waves of it where you start off a new quarter semester of yes, I could conquer the world. And halfway through start contemplating of, oh no, maybe I didn't manage time well.
Yeah. Should have been studying when I was busy watching a show or, whatever it was.
Busy working.
Oh, that too.
Living life. Creating balance.
Yes. All of the things.
Yeah.
Do you have any recommendations on how folks can maintain their mental well-being?
Yeah, it really is taking that approach of balance, right? Knowing if you focus and put all your energy in one part of your life, other parts are going to be affected. And if you also are experiencing some minor things such as frequent stomach aches, sleeping problems, just feeling extra burden from stress, having thoughts that keep coming up that are slowing you down, those are good warning signs of maybe it might be benefiting to seek some sort of counseling support. It doesn't mean that it's a forever thing. It just helps with those bumps in the road.
Yeah, when you were saying it's not a forever thing, one thing I was talking to about with a classmate and colleague of mine was that these services, they're not meant to be permanent. And I was just like, whoa, I've never heard it that way. And how does that affect your line of work, and just knowing that, these sessions, they do eventually come to an end, and what do you aim for towards the end?
Yeah. Well, one is to overcome some of those challenges, right? To be able to process it and to having some strategies to manage it. Overall, it's learning when things are starting to become a little bit too stressful, or when there is something that you really would need or want more support, and how to access that.
What does a person who wants counseling at Indian Health Center, what does that usually look like, and what are the hoops that folks have to jump through to get to you?
For our Native community, doors are always open. There's no closed door for our agency. For those that are seeking counseling, the way that we are set up, it's an integrated behavioral health program, meaning we're part of the medical department. So that means they would have a primary care doctor in our medical department, and it's their primary care doctor who puts in a referral. And that is how services can be initiated.
Okay. Awesome. And then for the folks who are Indigenous, do they need to be a part of a federally recognized tribe, or is it self-identified?
That is an excellent question, especially since the state we're living in, there are many tribes that are not federally recognized due to false treaties. So that would be a soft no on that part, but definitely be identified as part of the Indigenous communities.
Okay. Awesome. Well, thank you for sharing that. I know there's like I've been working on like scholarships and things like that with the Native students that I mentor. And that was one of their questions, because one of them is from a local tribe that's not federally recognized. And so there was that barrier between like being able to apply for certain scholarships just based on like not having federal tribal recognition. And like for me, I'm Navajo, and like they're federally recognized, so I have no problem. I'm like, oh yeah, there's all these Native scholarships, but for them, they weren't able to apply for certain ones just because of that.
Yeah, I definitely understand that stress, and I think those are one of the areas systemically how it is still so many flaws and barriers for people to access resources that really should be rightfully given. But unfortunately, the way that systems are created, it is a certain criteria that they need to follow. I was fortunate to be able to access those type of scholarships because my tribe is federally recognized. However, I have someone who is like a sister to me, very dear. We were in the same program, and she could not get the same type of scholarships that I received because her tribe is not federally recognized. Yeah.
Well, hopefully we can change that one day.
Yeah. We'll add it to our list of the need for mental health support, because for us sitting here talking about that, right, I see you clench, I'm clenching, where it's like, ooh, this is bittersweet. I got the support, but my friends and my loved ones couldn't, right? And that is a huge stressor, and that is that intersectionality of identities that really become problematic and cause internal stress.
Yeah, especially when you want to further your education, but you have, like you said, that barrier of monetary funds, and not having that is just stressful, because then you're like, oh, I have to work. Where am I going to work? Or, oh, I have to borrow money. Okay, how am I going to pay that money back? So things like that.
Yeah.
So what would you say are the most common like problems or things that people are dealing with when it comes to coming in for a session?
So what are some of the common diagnoses or
just things that you see people going through?
Yeah. Well, post-pandemic, a lot of diagnoses of anxiety and depression. A lot of people also worried and stressed about ADHD, because a lot of the things that we commonly use to cope with everyday life changed with the pandemic. And that's when it realized, whoa, some of the strategies we naturally were utilizing are no longer effective, right? We have no means of being able to do that on a constant basis. And then increased with more computer screen time. For a lot of people, that became really hard to be able to hold the focus and concentration. On top of having so much stress in life from the pandemic, that the focus and concentration is a common theme of sleep problems, focus and concentration, and a lot of trauma as well.
Yeah. I think I could definitely relate to the anxiety post pandemic, even though it feels like we're still in it sometimes.
We were in that new era pandemic, right?
Yeah. And You mentioned like some of the coping strategies that folks used to use for ADHD before not working.
Yeah.
What are some things that folks would do to, what are some things that folks with ADHD would do to cope?
Yeah. Well, whether you have ADHD or you have anxiety or depression, when it comes to focus and concentration, those type of coping things become challenging because you have this pressure to meet deadlines and your brain is like, nope, not today. We're not doing this. So it's learning strategies to utilize even your senses to help stimulate your brain and calm your brain at the same time, so it's not too overstimulating, so you can be able to hold some focus and concentration. There are a lot of different strategies, and I think if anyone has these type of concerns and feels like this is affecting their everyday life, that they really should seek and talk to a counselor, because what I will share is more general, right? And it's not to an individual basis, and for individually, each person functions and interacts different. So one strategy might work for one person, and for another, it's not going to be as effective.
Yeah, and I like that distinction that you just made because I also have ADHD, and I have friends and family members with it who it affects on a different range. And it also depends on if they have another diagnosis. One of my friends has a very active ADHD, and when she gets excited, she talks really fast. And I'm used to it because I grew up with it. But when other folks meet her, they're like, whoa, 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 she's giving me golden retriever energy, fast. And then when she gets settled in with you, then she'll talk normally for, match the cadence in the room.
Yeah.
If it's just me and her, we can go 100 miles an hour together. We ride that ride. And so because of her overexcitability, she decided to get on a medication to help her with that.
Okay.
And I've seen that improve her social interactions 100%.
Okay.
And that when she meets new folks, that she doesn't have that barrier of people thinking, oh, something's going on with this person because they're talking very fast. And that was just her being excited, and I knew that, and folks would learn that over time. But I mean, everyone's experience. I have other friends who just aren't on medication for it. Neither am I, and I don't feel any type of way if you are or aren't on medication. I feel like it's what works for the person.
Right. Exactly. You see, because all of our life experiences and our DNA are different. Our brain is all functioning in a different way. The chemical balances ranges. So that's where it's important to get the professional support, because clinically they are trained to be able to identify these differences.
Yeah, I like that. I just want to reiterate, whether or not you decide to take medication for you, that it's different for everyone, and there's no shame in whether or not you do have to or don't want to.
Right. Yep. Some fun facts about ADHD is definitely it's an early childhood sort of diagnosis. It's how the brain is developed. So the signs and symptoms would be before 12 years old. There are compensatory strategies at any age people could learn. And why it's called compensatory strategies and not coping skills. Coping skills is managing something in the moment, right? This is something that's happening in your life now. Doesn't mean it's going to be in a month or two from then, right? This is your brain. This is your life, right? So compensatory strategies is utilizing the strengths and benefits of how your brain developed to help with the areas that need that extra support. Because there is some superhero powers with ADHD brains. It's not all negative.
Yeah, I'm multitasking. But I think it's multitasking, but who knows?
Yeah, and another fact about ADHD is about 60 to 80% of adults go into remission or at least partial remission, meaning that if you get tested as an adult and you knew you had it as a child, doesn't mean you still qualify for the diagnosis. Some of that reasoning is you learned enough compensatory strategies and healthy ways of managing the deficits parts of attention deficits disorder. But it also is our brain isn't fully developed until you're mid-20s. And fully developed means you can process and get to use the front part of your brain for that logic and executive functioning. And as a child, it takes a little bit harder to access this area, especially if the midbrain is overactivated.
Mm-hmm. Since it is MMIP month, what are some things that folks who might have some trauma either associated with MMIP or other upcoming holidays, or like you were sharing earlier, like the season. So we have MMIP, Juneteenth is coming up, and then around this time of year is also when folks who are in school are talking and getting worried about graduation.
Yeah. There's trauma affects people year-round, but there's certain seasons that it seems like it's definitely more trauma triggers. And for many people, just understanding and knowing when you are carrying trauma, it doesn't mean that you can't effectively keep working and doing everything that you're doing, right? It sometimes doesn't feel like, oh, it's not really affecting my everyday life. When the reality, if you process it and talk about and reflect on what your everyday life is now looking like compared to prior to the triggers, there is a difference. So I really would encourage about receiving counseling, definitely some trauma support, being kind to ourselves, self-compassion, especially when it's coming to the graduation times, because there's so much stress and fear, and it's mixed feelings, right? You're leaving an era of your life, entering into another part that you don't know what the road's going to take you. But also all of the demands and worries about, did I complete the forms on time? Do I have all this? Am I going to pass these last classes? A lot of what ifs, right? And then for the MMIW, for me personally, it's very triggering. It is a hard time for me because I just think about what my family has gone through, what my ancestors have went through, what is currently happening now, and that constant fear of, am I safe? Are my kids safe? Could we all be really safe? Those fears of safety are legit, and it really is part of us, what we're born into. Those are things that are, for most people, inevitable, and for many various different reasons. But just speaking of the MMIW piece, that is, it can be a very triggery time for many people.
And what would you encourage folks who are going through these different traumas to like seek?
Well, one is just acknowledging that this is your brain, right? Your body and your brain is reacting to this. It's giving you the sign of, oh, we're on overload, need some extra support. For many people, like you said earlier, about oversharing, right? Trauma dumping. And it's because you're trying to find that safe space of like, my brain's overloaded. I feel like we have similar experiences. Let me just spill it all out on you. I'm going to just vomit it all out. And then those trauma bonds is something that can be created, but essentially then it's like vicarious trauma. So I really would recommend that self-compassion piece, having the touch. For me, it's my hand over my chest, over my lungs, taking a breath and acknowledging, this is how I'm feeling. I have every right to feel this way. And it is my fears. It is my worries. And it's okay. I am safe right now. We're okay. And knowing that if this is something that's affecting your daily life, really to seek counseling, to get connected to a therapist that has background in trauma therapy, or even a background in understanding your culture. That's another huge barrier, especially for the LGBTQ. I think you said more letters after that. I know it by LGBTQ.
Yeah, no worries. So it's LGBTQIA
Okay.
Plus, and then Two-Spirit is supposed to come before that.
Okay. Okay, so Two-Spirit LGBTQ. QIA. I got it.
It's the queer and questioning. That's where the double Q comes from.
Okay. Okay. And then the IA?
Intersex and asexual.
Okay.
And then plus is because there's still talks and debates about adding other letters to the acronym. I know they want to add K for kink and other letters for other ways of identifying.
Okay. Well, that's good to know. See, these are those revolving things that I'm feeling a little bit outdated on that I'm not up to speed with all the different acronyms. And I feel like I get tongue twisted when I'm going to when I get to LGBTQ, my brain says plus, and my mouth says no. We're done. You're gonna mess this up.
The one statement I hear folks when they share about that community is Q-munity, like queer community.
Yeah.
They've taken the word queer back and slowly changed it back to a word of pride and not like a hate, like from its hateful origins before. But I mean, it really depends on the population that you're talking to age-wise, because our elder LGBTQIA folks, they have a negative connotation to the word queer. And same thing with, I think, the word gay. It really just depends on like the age range and whoever you're talking to and like their level of comfortability with those words.
Yeah, definitely, like those individual factors, right?
I've met a lot of younger queer folks, and they are very comfortable with the F word. And I am widely uncomfortable with that. And other folks who are older are also uncomfortable, and I just think it's interesting based on like the age of folks and what words lose that negative connotation.
Okay.
Yeah, but I'm not using that.
Yeah, well, it's good that you stick to your comfortability, right? That is something that, from your era, that word was very negative. And for whatever reason of it being something acceptable, that's okay too. And I think that really reflects back where I was saying, for mental health, it really is our interactions, how we see the world, interact in the world, interpret things.
Yeah, it's like I was saying with the younger ones, I'm happy that they never experienced whatever word that they want to use negatively, and that they are reclaiming their power in that word.
Oh, yeah.
And I'm leaving it to them to reclaim their power.
Yeah, just like queer, right? And that has been definitely reclaimed. It is a very beautiful word.
And I like that it also means weird. And I'm like, stay weird. I like it. And so earlier we had mentioned time of like appointments and things like that, and that you think can be a challenge. And what can you elaborate on why it's a bit of a challenge?
Yeah, that there's just not enough time, right? There's not enough time in the session, and even for scheduling wise, right? Some places you can't get an appointment but for every 4 to 6 weeks. Fortunately, the way our program is designed, we can see people more frequently than that, because it is brief counseling. It's integrated behavioral health. But the time in the sessions, and I can say it's hard, because in the beginning it's managing the logistical pieces of it, and then you're needing, space to really build that connection, the rapport, the safety piece to fully open up. And the part of psychology and counseling is when we are digging deep and we are talking and discussing things, parts of our brain wakes up and other memories and thoughts come up, and then you kind of are left at like a cliffhanger, or left at like the end of a session. It's called like a doorknob effect of the session's almost ended, and then something very important got brought up, and then I'm sitting for myself on both sides, right? As a psychologist, I'm sitting there thinking, oh no, I don't want you to leave like this. I want to continue. I want to help you. I don't want you to leave with this this huge thing that you shared, right? I want that space for you to process it or at least sit in it. And unfortunately, there's more people than waiting to be seen. Mm-hmm. For me as a patient, as a client of it, I'm frustrated. I'm like, no, this just came up now. It's not fair. I just need a moment. Give me 2 more minutes.
Yeah.
I can't end this yet. So that doorknob effect does come up, but also even like where I was speaking of earlier, just trying to break the stigmas of mental health. Some people join and they will come to counseling and have some fears of it, right? Of, oh no, like it's a magic door being open and someone's seeing deep within you, mm-hmm. and you don't know you're deep within you.
Oh, yeah.
And it's not quite that way, right? Mm-hmm. So it's breaking a lot of the stigmas, and even for diagnoses, explaining it and breaking those stigmas to diagnoses. Mm-hmm. So that time, it can require a lot of time. And then that takes away from time for people to be able to address other things or to be able to process information, learn coping skills, things like that. Mm-hmm. Yeah, so time is really an essence.
Yeah, I've dealt with that as a patient of the doorknob effect. I think for me more it's been just self-care afterwards, because I already know that's a possibility, and like I have ADHD brain, so I'll jump. I explain my ADHD to people as national treasure.
Okay.
Just the way that Nicolas Cage was like, there's the bell tower here, this bell has a crack, because of this crack is pointed this way and the shadow is here, blah, blah, blah. Like my brain jumps every which way. Yes. And so because of that, and I already know that that's me too, it's not the person that I'm working with, that I need to make sure that my self-care after the appointment is even, like, accounted for. Yeah. And so that can either be me spending time with my safe person, my partner, or going to the gym and just, like, distracting my brain.
Yeah, that's excellent.
I try to do one or the other. If my partner has the emotional capacity to be there for me, then I'm like, just give me a hug, please. I'm feeling soft right now. And he's pretty good about being like, okay, fine, I guess.
I like that. You're being soft right now. I like that. I think I'm going to take that.
I'm vulnerable.
Yeah. You got excellent coping skills, right? Strategies to being able to handle that. Mm-hmm. For me, personally, it's that self-compassion piece. And I probably should embrace being soft. Like, that sounds really good. I don't think that's really aligned with me, but I want it.
Yeah, I know. I would prefer also not to be soft.
Soft. Oh, embrace it, because it sounds fun.
Yeah, I know at least, like, for the next 30 minutes, I am a tiny little baby balled up into the fetal position. I will be back to my normal Hulk self, but it takes a couple minutes to get back.
Yeah. You give yourself that space. That's good.
Yeah, and so that's been something to work through, and it's because I've been left at so many doors. But again, it's my brain, and I take full accountability for at least like half of those instances.
Well, definitely. And it's not really anyone's fault, right? Mm-hmm. It's not your fault that happens. It's just the phenomena of it. Mm-hmm. That's kind of how our brain works, and that's what happens sometimes in therapy, and it's not a personal thing, right? It's not the therapist being like, forget you, and it's not the client saying, 100%. Oh no, I want this to open up right now. Yeah. I held off. It really is.
It just happens.
Yeah, it really is. And it's good that you have your way of managing it. That's important. And for, anyone else out there that has these thoughts or concerns about it, is really working through and questioning about, like, how can you manage that?
Mm-hmm. So what other services does counseling offer other than, counseling for its namesake?
Yep. So we also have traditional healing, and we have our prevention center, which also includes that.
Okay. Do you know a little bit about those programs?
Mm-hmm. Right. So there's drum and dance that I believe is happening weekly.
Mm-hmm. I think it's on Tuesdays at Roosevelt Community Center, I believe from 5:30 till 7. But we'll share the flyer if you'll just watch it pass by the screen right now.
Yes, I promote it a lot. And poor Mike, I have not gone down there yet because of my personal work schedule, but I know that it is a very safe, open environment. And some things that come up for many people is, I don't know anybody.
Yeah.
I don't know what's going to be expected. And something overall with my experiences in our prevention team and at IHC is all is welcome. Come how you are. If you know what you're doing, great. If you don't know what you're doing, that's okay. If you don't know anyone, excellent. Now you got more people to meet and new friendships to grow.
Oh, yeah. And the instructor for the classes are Justina Duran, and she's just wonderful. I haven't also been to the class as well because of my old work schedule. Now I have a new one and I can go. So now it's just me not wanting to go yet.
Okay. I'll drop my kids off and run.
I know. You got to email me and say, hey, we're going today, right? But yeah, Justina is wonderful, and I've seen other folks who had no knowledge of traditional dancing and just learning from Justina and, being more comfortable, even doing their first round dance at a powwow. Oh, wow. Yeah. Okay. So I'm like, I'm ready for that one.
Yeah. We also have youth prevention services, so it's youth group, and they do a lot of wonderful activities. Some, there's always going to be a cultural component to it, and some are just part of living in the urban area here, too, like going to Christmas in the Park or going on local hikes. And then I think recently they did gourd making. They have a lot of mental health prevention type services where there is some things that Katie, our LCS, she's an LCSW, that she goes and does presentations and teaches about different mental health topics, such as the suicide awareness and substance abuse and different things like that.
Yeah, and I'm excited. One of our other episodes this coming month in May will be about the youth suicide prevention program that they have, and so we'll be learning a little bit more about that. So stay tuned for that.
Perfect.
And also you can learn more and stay up to date by visiting the indianhealthcenter.org/events, and you'll learn all about all of our IHC events, such as the powwow dance and drum group, as well as our group exercise classes that they have at CWO, and other cultural events like the other ones that we were talking about today. Well, thank you for listening, everybody. Rate, review, and subscribe. If you like our podcast, go ahead and check out our other content. We have Facebook, Instagram, YouTube, and our handle is at IHC San Jose. Thank you, folks.
Bye.